Well, hello there. In today's video, we're going to explain how do you enroll in Medicare? How do you enroll in a Medicare plan? Medicare should be simple, right? But the truth is it can be a little complex. There's a lot of moving parts. So in this video, we're going to make it simple for you to know how do you actually enroll in a Medicare plan in 5 easy steps. So step 1 is to determine, do you even need to enroll in Medicare? So in today's video, we're going to make it really simple. So like I said, step 1, you need to determine, do I need to even enroll in Medicare? You want to ask yourself that question. So let's answer that question. So how are you even eligible for Medicare? So if you're turning 65, you worked in the US for at least 10 years, 40 quarters, you paid into Medicare taxes, then you are eligible to enroll in Medicare when you turn 65. Now, some individuals do get Medicare under the age of 65 due to a disability, but that's not what we're talking about today. We're talking about you're turning 65 and you want to go ahead and enroll, right? So if you're working, if you're still working, you're not going to retire, because some people do decide to keep working past age 65, and you have health insurance through your employer, 20 or more employees, and this is credible health insurance, then you can in fact delay Medicare and get on Medicare when you retire. Or if you're getting health insurance through your spouse and it is credible health insurance, like I said, you can in fact delay Medicare. Now, what does not count as credible health insurance, right, for Medicare? ACA, health insurance through the marketplace plans, is not considered credible health insurance for not enrolling in Medicare. So if you have a marketplace plan, you need to go ahead and transition over to Medicare. If you have a private health insurance plan as well, you need to go ahead and enroll in Medicare. If you have a shared cost of like Christian type of plan, you know, the Christian plans, Christian ministry type of health insurance plans, if you have one of those, you need to go ahead and enroll in Medicare. So yeah, you definitely want to do a comparison, Medicare insurance versus health insurance through your employer, and see which one works out best for your situation. You want to look at your deductibles, your co-payments, your max out of pocket and such. However, you can delay Medicare if you have employer's coverage through your job. So step number 1 is to determine, do you need to go ahead and enroll in Medicare? Okay, so we kind of decided, okay, I want to go ahead and enroll in Medicare, right? So you have a 7-month window to go ahead and enroll, right? So you have 3 months before you turn 65. You have 1 month of your 65th birthday, and you have 3 months after you turn 65 to go ahead and enroll in Original Medicare. So what is Original Medicare? So you have 2 parts of Medicare. You have Medicare Part A, which is your hospital coverage. You have your Part B, which is your medical coverage. Part B, you're going to have a monthly premium. And then you have Part D as well, which is your drug coverage. And then you could also decide to enroll in a supplement plan. You could do a Medicare Advantage or a Medicare Supplement. So why do you need something besides Original Medicare? Because Original Medicare only covers 80%. So you need help with that 20%, okay? So step number 1, like I said, you want to determine if you need to enroll in Medicare, and we have determined that we're going to go ahead and enroll in Medicare, okay? So step number 2, you're gonna go ahead and enroll in Original Medicare, okay? We're not talking about a supplement plan at all. We're not talking about Medicare Advantage or a supplement at this point. You just want to get your red, white, and blue card from Medicare. You want to get your Original Medicare card, okay? So how do you do this? You can apply online at ssa.gov. The application takes about 10 to 15 minutes or so. They're going to ask you a few questions. If you want to go ahead and get your Social Security disability, you can do that with that same application as well. Or you could just apply for Medicare Part A and B. So that's the next thing you want to do, is go ahead, go online via ssa.gov and apply for Original Medicare. So that's how you apply online. Like I said, you have a few options. You could apply online, ssa.gov. You could call the Social Security number, or you could go to your local Social Security office. It takes 4 to 6 weeks for them to process your application. It's very important to take note that I highly recommend, I think I said this already, that you want to apply for Medicare as early as you can, 3 months before you turn 65, to avoid any delays. Please take a moment to like this video. Give it a big thumbs up if you are enjoying the content. It really helps others to find this video, and it helps the channel a lot. Thank you so much. Moving along. Okay, so we applied for Medicare. We're waiting for our application to process. Like I said, it takes 4 to 6 weeks. Now, what do you want to do next? This is step number 3. Step number 3 is you want to learn your options, all right? So you want to know the difference between a Medicare Advantage plan and a Medicare Supplement, okay? Because once you get your Medicare card, then you could go ahead and enroll in a Medicare Advantage plan or a Medicare Supplement. So why would you even want to enroll in an additional plan? Because like we said earlier, Medicare only covers 80%, leaving you behind 20%. So let's break down the difference between the two. So let's start with a Medicare Supplement plan. With a Medicare Supplement plan, it follows original Medicare, meaning whatever Medicare says that it will cover, then the supplement will follow and cover it as well and pay the 20%. So that's how the Medicare Supplement works. Now, individuals love a Medicare Supplement because you could go to any doctor that takes original Medicare. You could travel with this plan as well within the U.S. You could be in Florida for 6 months. You could be in New York for 6 months. As long as the doctor takes original Medicare, they will also take your Medicare Supplement. Now, there is an additional cost when it comes to a Medicare Supplement plan. So you have to pay a Part B premium, and you also have to pay the supplement premium as well. And you also need a separate drug plan for your medications. Now, say you're not taking any medications, you still want to enroll in a drug plan. Do not make this mistake. If you do not enroll on time for Medicare Part B and for a drug plan, you will get penalized for not doing so, okay? So you definitely want to make sure that you enroll in all of the parts, okay? So like we said with a Medicare Supplement, let's talk about some more of the perks of having a Medicare Supplement. Like I said, you could travel with it. You could go to any doctor that takes original Medicare. You don't have to worry about pre-authorization. You don't have to worry about step therapy or anything like that. So what is pre-authorization or step therapy? Sometimes the insurance carrier will say no to a certain treatment. You need to do step therapy. You need to try this first, or you need to get approval for certain treatments, tests, or procedures, okay? With a Medicare Supplement, there's no such thing. As long as Medicare covers that treatment, that procedure, or whatever it is, the supplement will follow and pay that 20%. So it gives individuals a lot of peace of mind. The best time to enroll in a Medicare Supplement is when you first turn 65, because there's no health questions. You don't have to worry about underwriting and such. So yeah, you want to look at your health history, you want to look at your family history and determine if you want to go ahead and enroll in a Medicare Supplement, because there is that extra monthly premium. But if you get on a Medicare Supplement Plan G, there is no copays. As long as you make your monthly premium, then you're good to go. Now let's talk about a Medicare Advantage plan. It works a little different than a Medicare Supplement. With a Medicare Advantage plan, it comes with extra benefits such as dental, vision, hearing, and such, right? With a Medicare Advantage plan, you have co-pays. It doesn't pay the 20%. You have a share of cost, so you have co-pays. So usually the co-pays are maybe $0 for the primary care, $20 to see a specialist, $15, $20, $30, $100 for x-rays. So you get the drift. You have copays. So as you use the plan, you will have a copay for that service, for that treatment, for that test, or whatever it is. You pay as you go. Usually you don't have a monthly premium, but like I said, you do have copays and you still will have to pay your Part B premium, okay? Also with a Medicare Advantage plan, your prescriptions can be included, so you don't need a separate Part D plan, okay? So it's an all-in-one plan. Now you do have to stay within network. There's HMO plans, there's PPO plans, so it's very important to know that you cannot just go to any doctor. You do have to stay in network with a Medicare Advantage plan. Sometimes you do have to go through pre-authorization or step therapy, okay? So that's the difference between a Medicare Supplement and a Medicare Advantage plan. So please do your research. Definitely talk to a broker that you trust to help you navigate which option is best for your particular needs. Now let's talk about step 4. So step 4 is going to be to gather your information and for you to determine your particular needs, what's important to you and such, to kind of help you decide on how to narrow down your plans, especially if you're going to go with a Medicare Advantage plan. This is really going to help you narrow down which Medicare Advantage plan company you want to go with. So what are you going to gather? So you're going to gather all of your doctors, your specialists, your dentists, wherever you get your eye care, all of your healthcare providers. You want to gather that information. You want to also get all of your medications as well. How often you take your medications, what is the dosage and such. And you want to take all of this information and talk to a broker that you trust. You also want to tell them about any special needs that you have going on. Do you have oxygen? Do you have COPD? Are you a diabetic? All of this is very important and very crucial to help your broker help you narrow down the best plans for your situation. Now, when it comes to enrolling in a Medicare Supplement plan, then the doctors doesn't really matter too much. All you need to ask your doctor is, do you take original Medicare? So you do want to call all of your doctors and just make sure or give the doctor names to your Medicare broker and say, hey, these are my doctors. I want to make sure that they take original Medicare. As long as they take original Medicare, then they will take your Medicare Supplement, okay? Now, when it comes to enrolling in a Medicare Advantage plan, this is a lot different. You want to pick a plan where most of all your doctors are in network, whether you pick a HMO plan or a PPO plan, okay? It's very important to make sure that your providers are in network. When it comes to a Medicare Advantage plan, this is when it's going to be important to make sure that your home health company is in network. Your oxygen supply company is in network, right? All of these things are going to be important. How much dental benefits can you receive from this Medicare Advantage plan? Does it cover crowns or dentures, right? So all of these little things are very important, so that way you know how to use your plan and you know what is covered within your plan. So like I said, it is very important to gather all of your information and understand your plan as well. Read your summary of benefits so that way you know how to utilize your plan and you know what is covered. Step 5. So the last step is you want to utilize a Medicare broker that understands the plans in your area. You want them to help you enroll in a plan, whether it's a Medicare Supplement plan with a drug plan, right? Or a Medicare Advantage plan. Why talk to a broker versus just calling several insurance carriers and asking them about their plans and working with an insurance company directly? When you work with a broker, then you have support of the insurance carrier and you have the support of your insurance broker as well, right? So when you work with an independent broker that have access to many plans, not just one insurance carrier, but many plans, you want to work with someone that has most, if not all, of the plans in your area to help you narrow down your search, okay? So if you have decided to enroll in a Medicare Supplement plan with a drug plan, it's going to be very important to enroll in a supplement plan that is nice and steady and stable in the market when it comes to rate increases, okay? So if you talk to a broker that understands the market, they can help you narrow down the search and help you with a supplement plan company that is stable in the market. This is very important. You don't want to get on a supplement plan that's going to start you out at a very low rate and then jack up the rates as you age, as you get older, and then you can't get on the Medicare Supplement plan if you can't pass underwriting. So it's very important that you talk to a broker to help you narrow down the search when it comes to Medicare Supplement plans and Medicare Advantage plans as well. So like I said, you want to work with an insurance broker that have multiple insurance carriers under their belt, so that way they can help you narrow down your search, right? Making sure that your doctors are in network, making sure that your medication cost is as low as they can help you get it, making sure that your oxygen company is in network, home health company is in network. So it's very important to talk with a broker that can help you narrow down your search, that can help you pick a plan that best fits your particular needs, your situation. Thank you so much for watching today's video. I hope you learned something new today. If you like the video, please give it a like. And if you know anyone that needs this information, please share this video. If you have any questions, leave them in the comment section below and I'll be more than happy to answer your question. If you need any assistance, give our office a call. We'll be more than happy to assist you. At the end of today's video, there are 2 videos that you can also watch. Thank you so much for watching. Please subscribe to see me again, and I'll see you on the next video. Thanks for watching. Bye.